This is a 32-year-old woman who presented with pleuritic chest pain and a 6-month history of dyspnea, which had been slowly worsening over the previous. These are the frontal and lateral chest rentgenograms. Note a peripheral homogeneous density close to the chest wall with a medial convexity. The differential diagnosis would have to include a pneumonia, a pulmonary hemorrhage, a neoplasia, and in this case, because of the history, pulmonary embolism had to be suspected because the density in the lung is out of proportion to the patient's symptoms. In other words, a pneumonia of this appearance should not produce a severe progressive dyspnea. There is a slight convexity of the pulmonary trunk, and note a very faint curvilinear calcification in what probably represents the wall of a left pulmonary artery. This combination of findings and history should be indicative of chronic pulmonary thromboembolism. The upper two images are mediastinal windows. Note calcification in the wall of the pulmonary artery and a mass that was a confusing finding at the time of surgery. Note also a peripheral density next to the left chest wall. The bottom image is a lung window which shows an extensive parenchymal process and an apparent hilar mass. A striking finding is the reduced pulmonary vascularity of the left lung. CT pulmonary angiogram revealed a cup-shaped defect with a mass that occupied the lumen of the left pulmonary artery. Note also peripheral densities and this patient had a paucity of the pulmonary vasculature throughout the left lung. A faint filling defect is seen in the dorsal wall of the right pulmonary artery. At the time of surgery, the left pulmonary artery was found to be markedly enlarged and firm upon opening the artery. A large thrombus occupied the lumen. We can see in the specimen also the curvilinear calcification of the calcium in the wall of the pulmonary artery that retrospectively was distinctly seen in a frontal view of the chest. The embolus was removed, and because the patient had what appeared to be a mass surrounding the left pulmonary artery and the left lung was markedly oligemic, a left pneumonectomy was performed.